friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Remember to subscribe, it's free. Hit that notification bell. Today we're talking about carpal tunnel syndrome. Everybody has two carpal tunnels. The carpal tunnel is a literal tunnel in your wrist. It's made up of bones on this side and a ligament, tendon, here. Soft tissue. The tunnel houses artery, vein, and nerve that goes to your hand. There are multiple nerves that go to different parts of your hand that actually stem from specific nerve roots in your neck. Should the bones of your wrist become misaligned, there's about 10 bones that sit right here. Should the bones of your wrist get misaligned, they will press into that tunnel and can compress the nerve and cause you to feel carpal tunnel symptoms, which is weakness, pain, tingling, all one, varying times. It can be varying intensities, or can be on and off. 75% of the time, the problem is not coming from your wrist, it's actually coming from your neck, because these nerves stem from your lower neck. If you have a subluxation of the lower neck, the vertebrae are misaligned, affecting those nerves, you can get carpal tunnel symptoms and never have a neck pain. There's a muscle that runs across the top of your shoulder. It's called the scalene. It actually starts from the lower neck vertebrae, attaches here. That, if it gets in spasm, can compress those nerves that go into your arm, hand, and wrist. So what do? You get adjusted. You get your wrist adjusted. You get your neck adjusted. You might need some massage therapy. If it is actually a problem with your wrist that is an inflammatory thing, usually from repetitive motion, cold laser surgery is the cat's meow for this. In 1995, the cold laser, which we use a lot of, we use the super pulse laser at our office, the Terraquan. The cold laser therapy, they wanted to bring it over from Europe. It had been used in Europe for 30 years or so, and they wanted to bring it to the United States for specifically carpal tunnel. Wouldn't you know it, the FDA did not approve it because the lobbyists for the hand surgeons were able to get the FDA to not allow it in the US. It took another whole 10 years to 2005 for the cold laser to be approved by the FDA for carpal tunnel. That's how good it works. So if you've got tingling or pain in your hands, let's not panic. Don't think right to the point where they have to slit your wrist and release that tendon so that your carpal tunnel gets bigger. Let's do what we can do just to improve our body function, get some body work done, and I'll bet you'll be very happy. Now, if you're somebody that we're working on wrist pain with, you're going to want to check out our median nerve floss video, also the neck stretches video. As always, putting the power and knowledge of your health back in your hands. Bye for now.